Welcome to Fuzzybutts and Friends. Well, as much as it drives Fuzzybutts all over this place, absolutely crazy when they hear me say it. I am the host of the show, Yer Big Dog, Luke Robinson, back again this week. And we also have back again this week, Ginger Morgan. She's the executive director of the Puppy Up Foundation. She's also the producer of this show, or co-producer, I should say. I didn't mean to give you a promotion there. And she's our trusty co-host. Ginger, how are you?
I'm doing well. Does a pay raise go with that promotion?
I know, but if you're the producer, that means you're the top line person and you take sole responsibility of everything. I'm not sure you're up for that job, are you?
No, because that would mean I would have to take sole responsibility for you, and no, I'm not up for that job.
Yes, that would not wish that upon anybody. All right, well, we've got an exciting show for everybody this week. It's interesting. It's a topic that we've never discussed before, and I have to say I'm not entirely 100% familiar with it, so it's exciting. I have a ton of questions. So in that vein, let's introduce our guest this week. It's very exciting. It's Dr. Clara Medalen. She is, I guess you're a chiropractor. What exactly do you call yourself?
Yeah, I generally introduce myself as an animal chiropractor. Trained as a chiropractor first. Yep.
Animal chiropractor. Well, Dr. Medalen, welcome to Fuzzybutts and Friends.
Thank you. Excited to be here.
All right, we like to start the show off every week with talking about the Fuzzybutts, since we are Fuzzybutts and Friends. So do you have Fuzzybutts of your own, Dr. Medalen?
I do. I've got 2 Australian Shepherds.
All right.
They're definitely Fuzzybutts.
Yes, the fuzziest of the butts.
They're high energy Fuzzybutts too. So what are their names?
We got Coda and Nero. Got a blue Merle and a red Merle.
Blue and red. Now, how do you spell Nero?
Nero as in the emperor, Nero. So we decided to name him after the Roman emperor, and he lived up to it, and I do not recommend it.
so Nero engages in a little bit of destruction and plays the violin.
Oh, absolutely.
I love the troublemakers. I've had 5 Pyrenees in my life, and every single one of them were troublemakers in their own right. So I love a Nero. All right. Well, next we'd like to talk about the origin story, or that's what we call it, how you got your start into animal chiropractic. So how did you get your start? How did you get involved with animal chiropractic?
Yeah, it actually has a lot to do with Nero. I started chiropractic school. I was about a year in. Nero was 4 or 5 months old at the time, and he suffered a series of concussions. So it was not something that I noticed at first. It was very subtle. He was just acting out. He was uncomfortable. He wasn't able to calm down. And then after the second concussion, he had trouble with his eyes. So he's got blue eyes. So we noticed right away he had 1 large pupil, 1 tiny pupil. So quite a bit of swelling in his brain. And he could not relax. He was pacing, he was panting, couldn't sleep, he was uncomfortable. There's definitely something wrong. And at the time, I had no idea what was happening. So being in chiropractic school, I took him to the animal chiropractor. They adjusted him and his eyes went back to normal that day. He could take a nap, he was relaxed. But for anyone listening to this, please take them to the vet first. Chiropractic is not meant for emergency visits, which it worked out well for him, but you never know in the future.
You know, it's interesting. I'm glad you said that, because it's kind of like the elephant in the room. And it's interesting because when we decided to do a show on animal, is it chiropractic or chiropractic?
Chiropractic.
Animal chiropractic, the field of studying chiropractic. Okay, so when we were discussing it and talking to some of our contacts, we have a lot of contacts, particularly in the veterinary oncology world, and we were reaching out to them. Who do you recommend, and what are your thoughts about it? What's interesting, Dr. Medalen, is that we actually got some pushback. It's like, no, don't do a show on that. Why would you want to waste your time? And I find that fascinating, but it's also reminiscent of my childhood. My dad was a neurologist, went to University of Texas medical branch in Galveston, Texas, became a nephrologist. And for my entire life, he did not like chiropractors. He just thought they were quacks. They were up to no good. It was voodoo science or something like that. And so I can't say I ever had a bias because I didn't know when I was a kid, but it certainly hasn't affected me. So now it's increased my appetite to learn more about it. So why is that? Why is there this criticism of your field that still exists today?
Yeah, it's a good question because chiropractic was started during a time where we were seeing a lot of that pushback for other fields as well. So it wasn't just chiropractic at the time. This is the very late 1800s, early 1900s. And at that time, we were seeing a lot of standardization of the medical field. So with that standardization and the development of schools in the United States, there was a lot of going back and forth onto who is practicing medicine and who isn't. And so chiropractors fell into the field of they're not practicing medicine. And what did us good is that we never claimed to practice medicine. Chiropractors have always claimed that, we do chiropractic and nothing else. We're correcting a misalignment in the spine. If it happens to help a disease or a disorder, great. But that's not something that can be standardized because everyone's going to respond a little bit different. So with that, there were pushbacks with other fields, but in chiropractic, there was a lawsuit that ended up happening between the American Medical Association and the Chiropractic Association because the AMA was putting out a notice that we were quacks and we were practicing medicine without a license. And we had gone through that process in the early 1900s, jailed chiropractors, and they finally determined that we were not practicing medicine at all, and therefore we needed to standardize the chiropractic license instead. So that's what happened. Then in the 70s, 80s is when I would say 60s, 70s, I think it was when we saw the AMA putting out that no medical doctors should refer to chiropractors. So that then opened up into a lawsuit, and the chiropractors did win that lawsuit for the quackery, but doesn't mean that has necessarily gone away, right? So we do see that still some people are not okay with it and don't quite understand what we're doing, and that's perfectly fair because if I always say you should question everything, don't just believe everything you're told. So when we started seeing animal chiropractic come about, that had been very prevalent in the United States before World War I. After World War I, World War II, of course, there wasn't a great economy, and the chiropractic school, the main chiropractic school at the time, Palmer, they went away with their animal chiropractic program. They nixed it, no longer did anything about it. So it wasn't until the 80s that we got that revamped. That was thanks to a veterinarian who got her chiropractic license. And throughout getting her chiropractic license, she was dissecting animals. She was boiling down bones in her basement. She was figuring out what is the spine doing, what lines of drive do we need to do to correct it. So she took a lot of the old knowledge. She took her own knowledge of veterinary medicine, and she combined it to create the field of animal chiropractic that we have today. So when she got out of school, she put together the American Veterinary Chiropractic Association, which is still ongoing today. She formed that, and she formed the first animal chiropractic school, which is now based in Kansas. That's the one I actually attended. It's called Options for Animals. So she put that all together and retired, passed it along, and it's still going strong today. And now we have quite a few schools in the United States that are certified to teach animal chiropractic.
Cheers to that. I'm of the opinion, or I should say the operating model, that if it works for you and or your kid, then keep doing it. If you get the results or the outcome with your health that you want and you're looking for, then do it. Why not do it? But right. I do know doctors. My dad was an old school doctor. He was the doctor. You got to call me Dr. Robinson. That was him. And so I always had this theory that doctors just didn't like to share the doctor with anybody else. That's like, you hold on to that title doctor so tightly. I'm not sharing it with chiropractors or
Right.
else.
I went through all of this to earn that, and
Because you
and
know
the
they don't
idea
like
that, yep.
because you know they don't like PhDs. Hey, why are you calling yourself a doctor? You only went through a couple of schools. I went through like 12. So but speaking of results though, Dr. Medalen, though, seriously, in all seriousness, you know, one thing that science does want or expect is reproducible results. And you mentioned that in your intro, you know, about the field of chiropractic. It doesn't always work, and it doesn't always work. It's more of an individual practice. So is that what also in all seriousness, perhaps one of the pushbacks is that you can't get reproducible results at the consistency or that the institution of medicine wants and expects?
Yes, and a big problem that chiropractors have with the reproducibility is because if you're going to do a study, you want it to be a double-blind placebo-controlled study, right? So in order to have that, you need to have the examiner not knowing if they're giving a chiropractic adjustment or not. You need to have the patient not know if they're getting a chiropractic adjustment, and then you need to have a placebo group. So of course, that's very difficult in standard chiropractic because the practitioner is going to know if they adjusted you, and the patient's going to know if they were adjusted. So we do have a couple techniques out there that can do those studies. That would be NUCA is a great one. I think they've got a very large field of studies behind them because it is dealing with mechanoreceptors in the skin. So it's very light touch, and they're making a neurological change with what we call the Pacinian corpuscles. So that is how they perform their adjustment. And therefore, the patient might not know whether they were adjusted or not, especially if that was their first time ever being adjusted in that technique. They're not going to know. And then you can have a separate examiner watching the practitioner, and the examiner does not know whether they're doing the adjustment or not because it's light touch. So we do have some of those techniques where we can get those results. But for the most part, for a chiropractic adjustment, it's just not possible to do that. So we do have a large base of case studies. And we've got other studies, of course, that show that, you know, it'll work in some cases and it doesn't always work in other cases. And a good example of that would be the very first adjustment ever performed. When it was performed, the practitioner thought he had developed a cure for deafness. So he had this janitor working in his office. He adjusted the janitor. He was like, okay, let me try this out. We're going to try something new. And the guy's hearing came back. And so here he was thinking that this is great. I'm curing deafness. So he had all these people coming to get cured by deafness. But of course, that's not how it works. It's not everybody's deafness is caused by a neurological issue. And so if that's the case, then of course, with these different multiple causes, you're not going to get the same results every time if your issue is coming from somewhere else.
That is interesting though, but you know, one thing that you know, I grew up in the environment that the institution of medicine was absolute, right? And what I've seen personally, witnessed, maybe other people have seen it differently through different eyes, but what I've seen in the past 5 years, and in the face and the witness of the pandemic and all the mistakes that were made, in whatever capacity, is obviously the institution of medicine is not infallible. It can be mistaken. It can make mistakes. But I think the most important issue, perhaps you would agree with me, Dr. Medalen, is that if it works for your kid, your Fuzzybutt, or yourself, that's reason enough to continue with treatment, continue with therapy. So you went to chiropractic school. And then where did you go from there?
So after chiropractic school is when you're eligible to take the animal chiropractic course. You can either be a veterinarian or you can be a chiropractor for that course. And that is a 5-month-long course over at Options for Animals in Kansas there. That's the one I went to. So with that, you fly over there for a week. You learn your techniques. You go and practice on your own pets back home. And then next month you fly out again. So you're constantly doing check-ins with the practitioners, which is why they want you to already be a trained professional at that point.
I'm going to interrupt for a second, Luke. I want to go back to the whole hearing where the doctor felt like he cured deafness. So I was in a pretty bad accident several years ago, and I was going to a neuro chiropractor, and he made some adjustments. And when I got in my car, I'm like, "Whoa, who turned up the radio?" You know, everything was loud for like 2 or 3 weeks. And when I went back to him, I was like, you know, when I was here before, you did something, and I said, did it affect my hearing? Because everything was loud. And then that's when he told me the whole kind of the history. And he said, yeah, so since he's left, and then somebody else, I was having a hard time hearing something. And the new chiropractor says, can you just adjust my hearing? And he just looked at me like I'd lost my mind. I was like, okay, never mind.
but the other thing, but that's a great point, Ginger. The other thing that there's another tremendous limitation of the institution of medicine, and that is it's very limited in our understanding, and certainly in our understanding of very complex systems. Organisms, the human organism being the most complex organism on Earth that we know of right now. We still know so little about our nervous system, our central nervous system, how the brain functions, certain aspects of the brains, and so on and so forth. So the fact that you can actually have someone treated, and for whatever reason it affects their hearing or improves their deafness, it can't be explained, because that in itself is a limitation. We don't know. Nobody knows. And certainly your MD counterparts don't know either as well. Wouldn't you agree?
Absolutely. It wasn't that long ago that we thought that our nervous system couldn't heal itself either.
Right.
You know,
Right.
That's really something we've realized in the last couple of years is, oh yes, if you damage a nerve, you can heal it. And now we still believe, most people believe that the central nervous system, the brain and the spinal cord cannot heal. And so I'm sure that's something that as we go along and we do better studies, more in-depth studies, we're going to find out that that's not true either. So we're constantly learning things about the nervous system. There is a ton that we don't know. So I always tell people, if there is an issue that you're having that in standard Western medicine, we're able to either, do a surgery or give a drug to decrease a symptom, but we can't touch the root cause because we don't know what that root cause is, then that's a good time to go to a chiropractor, because oftentimes it's going to have a neurological component with it. And so we can see results through there. So I've got a lot of very strange cases that come to me who are kind of at their wit's end, right? Their last resort. We have a miniature Australian Shepherd who has been incontinent since the day they got her. So she has never held her bladder for a single day ever. She's constantly wetting through her diapers, especially when she sleeps. And so we're now about 5 adjustments in, and she just went an entire weekend without wearing her diaper without a single accident.
Wow.
Yeah. So there are those strange cases where, can we say exactly what is the mechanism happening in there? No, but we have a lot of hypotheses. We have a lot of good ideas and research into what's going on, but out of all of those hypotheses, we're not yet able to say, yes, this is exactly it. This is what's happening every single time.
Yeah, we had someone on, not Dr. Shea, but someone else from the Chi Institute. They're now called the university, I think. And so I'm very fascinated with traditional Chinese medicine. And that's another thing that I also grew up that, oh, don't, those guys are quacks.
Right.
Don't. And I learned, as soon as I learned history, it's like, wait a second, the traditional Chinese medicine, they've been doing medicine for thousands and thousands and thousands of years. The Western hemisphere of the earth has only been doing medicine for 600, 800 years. So maybe they know something that we don't know. And it speaks to exactly what you're talking about, is they don't always know the mechanism of action. They can't write about it. They can't answer the question this is specifically how it works. But last time I checked, I was pre-med for a while before I wisened up. I decided not to go to medical school. And so I worked in pharmacies, and it amazed me that drugs that were so commonly used, like aspirin, they didn't even know how it worked. They didn't know the mechanism of action. So the parallels there, to me, are fascinating. So we know that it produces results and outcomes that somehow are not fixable by traditional means. But let's start, I guess, with the basics. Talk to us, Dr. Medalen, about the canine musculoskeletal system. Let's start with the basics. What
Start with the basics.
Yeah, what do pet parents, I guess my question is, what do pet parents need to know?
The most important thing that they need to know is that an animal adjustment should be incredibly gentle and light. There is a misconception that there's going to be a lot of cracking and popping noises, that we're going to twist the animal around, that it should be very high force, and that is opposite of what's true. Animals are very sensitive, and there's no reason that you need to do an incredibly high force adjustment, which of course is what a lot of the videos out on the internet are all about, right? They're very dramatic. So an animal should be relaxed. They should be able to control whether they want that adjustment or not. They should not be under anesthetic of any kind. If you've got an animal who is under anesthesia, they're not able to tell you if something is uncomfortable. They're not able to protect their joint if someone were to go too far. So you always want the animal alert and aware of what you're doing. And with that comes stabilization on the part of the doctor. We want to make sure that the doctor is always stabilizing their spine from underneath as well, that we're not just pushing into air, especially with our cats and our dogs, because they have very, very mobile spines. So what I describe it to my patients as is about the same pressure as testing the ripeness of an avocado. Really should not be a lot.
Wow.
And so that is the number one thing that we get is, is this going to hurt my animal? Is this going to be something that is dangerous in any way? And no, it should not be, because we are doing a very light adjustment to make a neurological change. We're not going to be pushing on anything to the point where there's ever damage to any of the soft tissue or the bones. Then you would have someone who is just not trained in animal chiropractic if that's the case.
Yeah, that's got to be very challenging, though, because it's entirely different than the human field of chiropractic, its counterpart, because the two things that we know about our Fuzzybutts is they can't communicate with us, and they can't let us know things that give us feedback loops, essentially, while you're treating them. You don't know that. We don't know that. And the second thing is they have a different threshold of pain, too. So it must make it a bit more challenging for you.
It actually makes it easier.
Oh.
So most animal chiropractors that you talk to will tell you that they wish they had started doing animals sooner because it's made their human practice better. Because since the animal can't tell you exactly where the pain is, it's up to you as the practitioner to figure that out. And therefore, you're going to read those really, really subtle signs. You should be well versed in what the animal is telling you, those very small changes. Like we had a dog who came in who we found out was having headaches. And the only reason we knew that is because every time her brother barked, she would wince a little bit. But it wasn't something that was ever noticed at home because it was so slight. So that was something that you just got to be paying attention to. When you're feeling along the spine, you're looking for areas of heat or any subtle changes in swelling. And that really cues you into areas that are going to be tender when you touch them too, so that you can be more gentle in those areas as well. So with our animals, they have a lot of ways that they can communicate with us if we're actually paying attention to what that communication looks like. And they'll definitely tell you if something is past their comfort zone.
Yeah, it's a great point. I didn't think about it until you elucidated it for me. Is that people really are a terrible feedback loop? They give you wrong information. They want to please you. The humans are just a mess, right? And it makes the job of the diagnostician that much more difficult. So it's
Absolutely.
great
Absolutely.
point.
You end up chasing the pain, and the pain is rarely in the area where the problem is. Generally, that is just some sort of compensation happening. So if you're adjusting the area where the compensation is, you're not actually treating the root cause of the issue. So then it's up to the doctor to look past the area of pain and find where it's actually stemming from. And with that, with our animals, it is we're using the mechanism, if you remember from school, force is equal to mass times acceleration. That's how we perform an adjustment. So if we're putting a force into the body, then we need to either have a lot of mass or we have to have a lot of acceleration. So for our dogs, we need to have a very quick adjustment. It needs to have a lot of acceleration behind it. It's very short and brief and fast because I've got more mass than a dog does for the most part, right? So I need to use more acceleration because I should not use my mass to adjust that dog, right? Then it's going to be too much force. And when in the case of a horse has much more mass than you. So trying to use your own mass to get an adjustment isn't going to get you anywhere. So you need to use acceleration to counteract their mass. So two different scenarios using the same equation. And then with humans, it is really all about personal preference. I know people who do very big adjustments, and those are the clients that they're going to attract, the people who like those adjustments. I myself like very, very gentle, light adjustments that don't feel like much on the surface. That's what my body responds to. So we always say in chiropractic that a standard chiropractic adjustment will help 80% of the people 80% of the time. And then for the rest of it is where you look for someone who does a different technique that your body might respond better to.
You have horse patients?
I have had horse patients in the past. It's not my specialty. I prefer small animals since they do not get as much focus in the animal world. Horses are really the standard animal patient for chiropractors.
I was going to say you seem to be of small stature. No offense intended, but it's quite the visual. It's seeing you adjusting a horse. So I skip over a lot, and my apologies. I have to make notes, and sometimes I can't even read my own writing, and I jump around. So you were at that point at chiropractic school, and you said you could either go and chiropractic practice, or you can go to vet school. I'm assuming you went to vet school. Is that correct?
I was actually a chiropractor first.
Okay. Did you go to vet school?
I have not. No. It's always in the back of my mind, though.
Okay. Well, I didn't mean that in any particular way. I just wanted to clarify that. And so after that, after you decided to go into practice, is that how you started your practice, Cloudberry Lane? Is that right?
Yep. I started Cloudberry Lane here in Oregon, and that's all we do is animals. So I wanted to be a specialist and provide the same quality of treatment as a human would get walking into an animal or into a chiropractor office. So along with that is coming up with objective measures to track our progress with our patients, because in human chiropractic, we have x-rays, we've got thermal scans, we've got a CLA, we've got all these different techniques you can measure how much weight someone's putting in your foot. So with animal chiropractic, we don't see that happening very often. So that was one of my main goals with setting up Cloudberry Lane, is to find those objective measures. So we use TechScan, which is a pressure sensing walkway system, measures acceleration, stride length, how long a dog is standing on the foot, how long does it take them to swing that leg forward. So we get all these nitty-gritty details that help us to formulate a full idea of what's going on with this animal. Are they compensating correctly? Do they have pain that they're just not showing us yet? We can pick that up on there. We can see how well they're able to transfer their body weight into each individual foot. Is there one that they're avoiding? So it gives us a ton of inside knowledge that we can use to then treat them to actually get to the root cause of what's going on there, and then track their progress as they go along. We always do our reevaluations, make sure that there isn't anything that crops up that's new, make sure that we are actually resolving what we think we're resolving.
So
do you also practice on, are you also, can you practice on humans as well? Or you mainly, or all you do are animals?
I am licensed to adjust humans. I can. I choose not to.
I can only imagine why.
So how long has Cloudberry Lane been in existence? How long has your practice been around?
So we've been in Oregon for 1.5 years.
Okay.
Before that, I was up in Alaska practicing up there. That's originally where I'm from. So we were on a small island there, about 2,000 people, treating people's animals there for 1 year or 2. And so we moved down here and started up the practice.
I was going to say there's probably a whole lot of people, and maybe that's true of animals too, in pain up there. And that's pretty rugged terrain up there. So you probably have a lot of use cases. So walk us through somebody who grew up with this preconception, not a bias, but just a preconception about the use of traditional medicine and the use of chiropractic. When you have a dog, so your focus is small animal. So say I have, I'll use an example. I have Indiana Jones. He's my 4th Fuzzybutt, my 4th Great Pyrenees, and he's 11. He'll be 12 next month, I think. Yes, that's right. He'll be
this month.
That's right. Just turned June, so he'll be 12 this month.
Yeah.
And over the past year, he's had a decline in his hind leg mobility. And we took him in and we got X-rays, and clearly he's showing some signs, or there's an indication he has arthritis in his hind legs. So as I'm assessing this situation as a pet parent, as the dad of my dog, Indiana, I'm thinking, okay, I want to do everything I can to extend his quality of life and to give him comfort. So as a pet parent, can you kind of walk me through how does the pet parent know they've got one of their Fuzzybutts, one of their dogs has some pain or has some issues that traditional veterinary medicine is not resolving? When do they come and see you? How do they know to come see you and try your services?
We've got 2 different types of clients that come in. We've got our wellness clients and we've got our corrective care clients. So what you're talking about is more the corrective care is the animal has now gotten to the point where they can't hide that pain from us anymore. And that's a really important thing to remember, because our dogs and our cats especially are not going to tell us that pain until it's become so extreme that they can't hide it. When I go see a chiropractor, I am normally going to say that my most extreme pain is about a 5 out of 10 on the pain scale. And with that, I'm still probably not going to be limping at all, right? And I only have 2 legs. I only have 2 areas that I can compensate with for the other side. So when a dog starts limping, they've now exhausted all 3 other legs that they can use for compensation, and they're just not able to hide it anymore. So I always tell people that's when they've reached their maximum pain threshold. They're now 10 out of 10 pain. And so we can absolutely help that animal, but it is more helpful if you start before that point, right? Research shows us that dogs can develop arthritis as young as 2 years old, especially our long back dogs, our dachshunds, our corgis, etc., right? So if we're adjusting a dog and it takes the same amount of pressure as testing the ripeness of an avocado, think about everything that your dog has done to themselves in their childhood. They fell down the stairs, they got stepped on, they got T-boned at the dog park, they fell off the back of the couch. You know, I've had dogs who have jumped off the balcony. Like, these dogs have done everything in their power to hurt themselves. And we look at that and we say, oh, he's fine because he got up and he brushed it off. But he's probably not fine, especially if you start to see some behavioral changes. If he's getting irritable after exercise, if he is snappy around dinner time, if he is a little stiff in the morning getting up and he doesn't want to be touched. We have a dog who, if you wake him up, he will bite you and break skin because he's got extreme low back pain. And so you startle him, he seizes up, he tightens his low back, it causes pain, and he reacts to that pain. So it is great when I have these people come in for corrective care before it needs to be corrective care, right? We're preventing things. So we get a lot of people from the dog show world and a lot of breeders, a lot of people who do sports with their dogs, bring their dogs in for wellness care because maybe they're not striding out fully on their left shoulder. Right. And so we put them on the gait analysis and then we see, okay, well, he's not striding out on his left shoulder. He's actually got pain in his right hip. And we can see that because he's got a short stance time and a long swing time. So he wants to hold that leg up for as long as possible. So with that, then now we know, okay, it's actually coming from the right hip. So we're going to correct the right hip. We're going to free up the chain between the right hip and the left shoulder. And then we're going to help the left shoulder because he's no longer compensating for the right hip. That makes sense?
It does, yeah.
It does, yeah.
I'm actually just a little bit. I'm dreading. It's concerning me a little bit because you were like, well, usually we see patients on earlier in the process before the disease state develops to the point of Indiana. But you must see geriatric patients though, and patients that have chronic.
Oh, absolutely.
So
yes.
I guess I like to make, as Ginger would probably agree with me, I like to make everything about myself. So let's make this about myself. So would you recommend taking a 12-year-old dog that has that you can see on the scans, you know, physically there's signs of some arthritic erosion and the ball joints. Do you recommend seeing a chiropractor if they can help out in any way? Is that something you recommend?
Absolutely. Absolutely. A good example would be one of my patients who started in this last November. She has a severe rounding through her back. She hunches her back. She's got a lot of pain in her hips, very weak in the hind end, and a ton of arthritis going on. They really thought that they were going to have to put her down over Christmas, but they started in November. And she's still going strong because we've got her up and running again. She's walking, she's taking hikes, she's walking her little girl to school every day. And so as soon as we are able to get in there and correct that pain, we can really just restore quality of life. That's what it's all about. Can we undo that arthritic change? No, we can't. Right. But we can make her feel better. We can make her move better. And we can activate all of the nerves into the weak muscles that maybe haven't been responding for a long time. So then we can start building strength in these areas of weakness that essentially her brain has forgotten about those muscles because she just hasn't been able to use them in so long. So then we can really build up that strength again and keep them comfortable and make sure that they have a good quality of life, that they can be a dog and enjoy themselves again.
See, so how would we go about finding a chiropractor in our area? And how many chiropractors, is that what you were going to ask, Luke?
One of the questions, but go ahead. Exactly.
How many? Hey, I am the co-producer or co-host or whatever. I get to ask a couple of questions. So how would we find one in our area? And are there very many animal chiropractors?
It depends on the area that you're in. And it depends on the state in which you practice as well, in which you live, in which they practice, right? So with animal chiropractic having been refreshened in the 80s, there are still different chiropractic laws in every state for animals. And so the best way is to go to the American Veterinary Chiropractic Association, or alternatively, there's the International Veterinary Chiropractic Association. Both of them have a find a doctor in your area page. So you can go on there, you can find a doctor that is certified in your area, And not everybody is going to be certified, and they don't have to be. These are independent organizations. So it's not something that an animal chiropractor is required to have, but it is a great starting place just to find someone who does it in your area. And it will have both veterinarians and chiropractors who practice animal chiropractic listed on there.
Yeah, I'm so glad we're actually having this discussion, because I on a daily, I dread daily Indiana's, deteriorating condition. And I'm at the point now where I've already been looking at, well, do we do hip replacements in dogs? I mean, what can we do? Because he's my boy, and I want to keep him around and give him a quality of life for as long as I can. My other 3 dogs that I've lost have all died from cancer. And there's nothing, we exhausted every means, everything possible. But what really, the horror to me is having to give one of your mates, one of your Fuzzybutts, rest when they're still good, they still have a sound mind, and they're still have a good disposition. They have, except for their physical debilitations, they have a good quality of life. So I dread that. So the way I look at the field of chiropractic, I'm glad we're having this conversation, and this is what I have to say to critics of animal chiropractic, is I look at it like a pet parent. If there's something wrong with my kid, I want as many tools in my toolbox. I don't discriminate. I don't have a bias. I will do anything and everything to give my kids comfort and care, the appropriate care. So let's go. We're jumping around, and we were going a little long on some issues, and there's some actual techniques that I want to get to. So are there any? So it seems to me what you're saying, Dr. Medalen, is that if there's any discomfort, your dog or your cat, your small animal is not feeling well, there probably is a good case just to go visit an animal chiropractic, just as that additional tool to see if there's any comfort that you can offer. Is that a fair assessment?
Absolutely, absolutely. My youngest dog has been under care since he was a couple months old, and he's very accident prone. But being an Australian Shepherd, he's never going to tell us that he's in pain, right? So he's one of the dogs we play fetch in the house. He'll slam his head into the door frame. He'll back himself up into a wall. He has accidents that would cripple me. And yet he just carries on as if nothing is happening, right? So we got to pay attention to the more subtle signs of pain, which are going to be if your animal is licking or chewing any area excessively. It's a good starting place. They're probably chewing on that because it's painful in some way, and that's really their only solution to fix their own pain, right? So if they're paying any close attention to areas, if they're cautious with you touching any area, so if you touch their hind end and they give you that look of, I'm a little hesitant about this, I'm going to watch what you're doing, I want to make sure you're not going to hurt me in any way, then they probably got some pain back there. So it's always going to be those subtle things. It's all about animal behavior and figuring out what are they trying to tell you. And so a good place to start is pain, because we've all had aches and pains. I've had knee pain as a child. And that's, of course, not something that you generally see taken to the chiropractor until it's become arthritis, right? But if we take care of it at a younger age, then we can preserve the integrity of that joint better. And so that's why I like to see wellness patients, but we learn something new with every single animal that we own. And so there's no wrong answer. Whenever you're able to take care of your pet in the best way that you can do it, because we're always going to have guilt as animal owners. There's always going to be things, I wish I had done such and such for this pet. I wish that I had known this thing about this certain disorder, for my last dog, whatever it is. And that guilt is just because we're good pet owners. It's just because we care. So there's nothing wrong with having that. It's just you do what you can in the time that you have it.
Yeah, well, the guilt is real, and I believe necessary. I carry guilt for the mistakes I made for my 3 boys that had cancer, that I lost to cancer, but we did the best we could do. But that guilt is real. It's important in the stress, because you're making medical decisions on behalf of another living being. And that's a tremendous responsibility. One that you have to take seriously, one that you have to think about all the time. Am I doing everything? Whether you're kids, they're kids of a canine, of a fuzzy butt kind, however cute, whatever cute manner in which you want to say it, that's a reality. You have a dog, you adopt a dog, you're now responsible for their health and happiness. That's a tremendous responsibility. And I think that guilt is real. And that's the purpose of Fuzzybutts and Friends. Our job here, I believe, Ginger could disagree with me if she wants, I'll fire her if she does, is our responsibility here is to, I'm smiling and laughing for those that are listening to this on iHeartRadio or Spotify. I'm laughing, I'm smiling, we're kidding, I'm kidding. But that's what I feel like our responsibility here is here with Fuzzybutts and Friends, is that we want to have all the tools. We want to have everything, get all the data and information and all the scenarios out for pet parents, so that when they're in a situation and they have one of their kids that's in intractable pain and that traditional medicine can't resolve, or whatever the case is. Actually, I like what you said earlier. I think that the more hands that you have on your kids, giving them an assessment, especially because they can't communicate with us, I think that's important. So I'm making a case, just a strong case, that going to see a chiropractic, what do you recommend? Is it a yearly, you said the wellness, is it a yearly thing for the wellness? And then if there's, you said wellness and corrective. So is it, if there's a problem, you come in and you correct it? But do you see your patients on a periodic basis just to check them out, put hands on them?
Yeah, absolutely. My own dogs get adjusted once a week or sometimes every other week, depending on what's going on with them. And it takes 2 weeks for scar tissue to form. So every 2 weeks is a great place to start. Once a month as well. You know, you're not going to see them backslide if you're doing once a month. Just correcting the problems as they come up, the sooner you can get it corrected, the sooner that we restore the blood flow, the lymphatic flow, the nervous system flow, right? And so that's what I recommend for wellness is seeing them at least monthly, if not every other week. Beyond that is where we really start to see the problems crop up, of course, because we want to stay ahead of the issues. If we're seeing an issue, we're not staying ahead of it, because like I said before, right, a dog's not going to tell you until it's extreme, until it's 10 out of 10 pain. And so with human chiropractic, we see the similar things, right? Most insurance companies will give you 12 visits a year so that you can go to the chiropractor once a month. If you can go more often than that, great. I get adjusted once a week by my own chiropractor.
Oh, that would be nice. I go once a month, and when I walk in, I say, I'm here for my attitude adjustment. So they all laugh at me and they're like, well, how is it? I said, well, you know, if you have pain in your back, it's going to go to your knees and it's going to go to your feet, or it's going to go, it's going to adjust my attitude if I have no pain. So
absolutely.
I wanted to
there go my dog.
Ginger goes to see her chiropractor more than she sees anybody, I think, in her life. Yeah. So
I go at least once a month.
She's a true believer in it. I just I don't have a lot of experience in it, but now you've convinced me. You've made the case for me now to take Indiana. Actually, I'm going to take both my kids, because Indiana is going to be 12 in a couple of weeks. But my youngest addition to my family, Grayson, he's a 3-legged Pyrenees, and we're already having problems. We're already having some early signs of arthritis. You said 2. You've seen some kids that pre-arthritic or arthritic at 2, and that's what we're experiencing with him. And so you've certainly made the case to take both of my kids to a chiropractic. Hopefully they have one here in Memphis. We travel, so if not, I'll find someone elsewhere.
Oh yeah, there's definitely chiropractors in your area.
Pardon me. I would think so. You know, we're not out here in the boonies.
Yeah, I believe there's one in Eads, which is about 30-40 minutes from here. So it's not horrible, but I don't think we have one actually in Memphis.
Well, I'll find one, because Indiana is my pressing concern, because, you know, if there's any alleviation of pain, if there's any corrective measures that a chiropractic can resolve, then that's certainly something I want to pursue. But
And if we can adjust his attitude sometimes, that
It
would be
absolutely needs an attitude adjustment. Indiana is all attitude. See, that's the thing. I'm terrorized daily because he's like a kid. He's still so happy and so young. He has a lot of attitude. He's a lot of tude left. And so I just want him to be comfortable for as long as possible. So since I'm less well versed in the field of chiropractic than Ginger is, Dr. Medalen, walk us through some of the terms that I'm not so familiar with, which I guess are techniques and techniques, I guess. Let's start with subluxation. I'm probably mispronouncing that. And what's the correct way to pronounce that?
You got it correct.
Oh, wow.
Correct. Subluxation. Yep.
Imagine that.
So subluxation is, I'll often use the term misalignment because, of course, then we don't have to explain what that term means. But the only difference between saying misalignment and subluxation is subluxation means that there's a neurological component to that misalignment. So you can have misalignments in your body that do not need to be adjusted because the primary misalignment, the subluxation, is causing the secondary misalignment. So if you correct the primary subluxation, then you'll correct that secondary misalignment. So it's just a simple term to describe what is it that I'm looking for. I'm looking for a joint that is not moving properly that's causing a neurological issue.
And that would be the area that you focus on then for treatment or therapy, correct?
Correct. Yep.
Okay, and you mentioned this earlier, what is TechScan Strideway? It's a big word.
TechScan Strideway. TechScan is a company that developed a Strideway system. It is a pressure sensing mat that the dog walks across, originally developed for people. And then they have developed a animal portion of that too. So that's all it is. It has pixels, pressure sensing pixels in there. It will measure when the dog's foot touches it, when it takes off. Gives us a pressure map of the feet, percentages of weight bearing and stuff like that.
So it can give us quantitative data about the misalignment and how it's affecting their gait and movement and so on and so forth. Is that a fair assessment?
Yep, correct.
Okay, and then the last term I have, actually I got two more, kinesiotape. I know what kinesiology is, but what is kinesiotape?
Kinesiotape you see on a lot of athletes. Rock Tape is the brand that I use, and there you can use just about any kind of brand. It's a fabric stretchy tape that you put over the skin, or for dogs, right over the hair. What it does is it will stimulate the nerves depending on the pattern that you put the tape in. And so you're putting the tape on so that as the hair moves underneath the tape, it's activating all of the nerves in the hair follicles. And so you can make a neurological change with that kinesiotape. So you'll see a lot of athletes use it for various things, but most often we're using it for strength building or proprioception. You're using it for decreasing inflammation, or you can use it to get rid of pain as well.
Is that something that would be used in the case of arthritis?
Absolutely. Wow. Absolutely.
I'm definitely going to check that out. Is that so? And you can wear it on, and they create this tape for different body parts, different areas of the body. Is that right?
You cut the tape to suit your needs.
Okay.
So whatever area you need to cover, I mean, there's so many videos out there on YouTube of, if you look up a problem and say, you know, I've got a hamstring pain and I need rock tape for it, you'll come up with videos on how to target that area. It's a very, very common method used by chiropractors, by athletic trainers, by PTs. Yeah.
I think I've seen it before on athletes. I do occasionally watch athletic events, and I have a pretty good idea of what you're talking about. What about, speaking about interesting cases and notable use cases, have you treated any three-legged dogs? Because we have, because our foundation, the Puppy Up Foundation, we see a lot of osteosarc patients that have subsequent amputations. Do you see a lot of amputees as patients, and how can chiropractic help them?
Absolutely. We've got a good example is her name is Fern. She was a rescue that a year after she was rescued by her people is when they decided to amputate her leg. And so she's missing her right back leg. They they did not realize some of the subtle pain signs until she was getting chiropractic care, and they were able to pinpoint, oh, okay, when she does XYZ, she's in pain. So for her, she was always very panty dog, panting constantly. And they just thought, okay, that's just Fern, until she had that leg amputated. And then she started coming in to see me, and she stopped panting so much. And then when she played too hard, that she'd start panting again until they brought her in. So that was her sign that she was in pain. And it's very easy thing to manage for dogs. We've got a cat who is a tripod as well. So it's all about relieving tension in areas. If you've got an animal who has gone through, 5 years of life, and they've already had injuries in their past. They've already started developing scar tissue in areas. They've already maybe lost some of their normal compensation patterns. They're now running out of options to compensate for this new big injury. So then they're going to use everything in their ability just to keep going forward, right? That's what they care about, is making sure that they can do what they perceive their job to be. If it's protecting you, if it's playing ball, doesn't matter, right? They're going to keep going, going, going. And so they're going to keep doing that as long as possible. With our three-legged dogs, it just means that now they're putting extra weight on another leg. So we want to take a look and see, are they doing that correctly? Have they taken the weight off of, say, the right hind leg? They no longer can put weight there. They don't have that leg. So did they transfer it all over to the left hip? That would be improper. That would be improper because the for the listeners,
I can hear a Fuzzybutt. I can hear a Fuzzybutt panting and talking about panting. Somebody was panting in the background. Is that Coda or Nero?
This is Nero. He has decided it's time to play.
Of course, he's causing trouble on the podcast, Nero, naughty boy.
Always.
Well, yeah, he's a cute fellow, but I guess he won't sit still long enough for us to get him on camera. Well, one thing with it's spooky how similar Fern's situation is to Grayson's. He was an abuse case, and that's why they amputated his right back limb, was from abuse. And I got him to foster him. Then he tricked me, and I adopted him. And I'm probably going to sue him for fraud.
So what limb? What limb?
Back, right?
What limb?
Yes.
You have two choices.
I'm dyslexic, so I get things inverted often. So I know as much as you like to rib me about that. But Dr. Medalen, one of the things that I observe, and I think, and I try to learn, and we know in humans the phantom limb pain is a very real phenomenon, and I truly believe it's a phenomenon that's also true with dogs and cats as well. Have you had any successes treating phantom limb pain, or have any ideas about that?
That's one that I don't have a good answer to, because it's hard to say whether it's pain in the stump that has been amputated, right? The pain in what's left. Hard to say whether it's pain there or if it's pain that the dog is experiencing if they think they still have a foot back there. So of course, that's a little bit more difficult to say, where do we think the pain is coming from?
Well, there's some
father had his leg amputated above the knee, and there would be times, even years later, he would say that foot itched. And obviously it wasn't there. He would say, oh, my foot itches really bad. And I was like, well, scratch it. He goes, no, it's not the foot I have, it's the one I don't have.
That just sounds like such a nightmare scenario to me, to have an itchy foot that doesn't exist. That's like a metaphysical nightmare for me, and that's what I want to avoid with Grayson, is that we don't know, but it seems to me though that there is some clear discomfort there. There's something bothering him. So my guess, my only hypothesis is that it is phantom limb, because he seems to be, or appears to be, uncomfortable in that area. But it certainly does warrant itself to go on to see a chiropractor, though. That's for sure. You've convinced me of that, because human science is not making is Western medicine. There's no treatment for that, except, or like with people, you know, our Western medicine is just give them a pill. If there's a pill for it, let's do that. Let's prescribe that. And if there's no pill to prescribe, well, then you're kind of screwed. There's nothing else that we can do.
That's the reason I started seeing a chiropractor in the beginning, is when I had a really bad car accident. My lower back hurt. And I went to the doctor, of course, originally I went to the doctor, then I went back, and one day I called up there and I was like, I have to see him. And he's looking at me, goes, I'm not going to give you narcotics. I'm like, oh, wait, I'm not a drug seeker. I said, I don't think that the drug is going to take away the pain. It may mask the pain. I said, what do I do about the pain? And he said, you need to go see a chiropractor. And I was shocked.
Wow.
I was really shocked. So, and I did. And literally that first adjustment took away about 75% of that pain.
Yeah, because it seems like that's what is most often prescribed for anything that you describe as pain or nerve pain is a powerful, I don't know if they're all opiates, but they're powerful meds, and they just knock you out, and nobody wants to go through life just non-functional. That's another, I just keep going back to, it's just amazing we're in 2023 and there are still people out there that say, don't go try that other tool out there that could possibly work. Don't go do that. All right. So are there, I think those were the terms and techniques that I wanted to go over. Dr. Medalen, are there any other notable use cases such as Fern that you want to share that would be of interest to our audience?
Yeah, I would say that what I see a lot of is dogs with disc herniations. So I would like to highlight that, because I know that so many people are really given the option of a $10,000 surgery or to euthanize their pet. And that's still one that we get some pushback with veterinarians on. So I just remind people that if we were not able to help a disc herniation patient, then you would absolutely not see us practicing on humans, right? With the laws set up as they are, we tend to protect humans more than we do with dogs, right? So we see humans with disc herniations constantly in chiropractic. It's a huge, huge field for us. And so the same goes for animals as well. There's absolutely no reason to have to put your animal down if they've got a disc herniation. You should be able to go see a chiropractor and help them with that. And so we want to make sure that they are able to walk again, to have bladder and bowel function again, all those things that are really, really scary to watch. We just had one of our patients yesterday who he had a disc herniation. He's been under care for a year now, and they're now moving over to New York. So they, on their last visit, the owner, she said that, we had given him his life back. And it just, that really makes it hit home, is he would have been euthanized. He's now he took a 14-mile hike the other day. Like,
wow.
Yeah.
I'm not sure I can restore Indiana Jones to that. I don't know if Indiana ever did 14 miles, but that's what it's all about. I mean, it's that I am an N of one guy, right? I mean, a sample size of one. Every patient matters, right? And so to me, that you can't necessarily reproduce the results to satisfy whatever requirement the scientific community has. An N of one still matters. The pet parent that says, hey, you changed the life of my dog forever. That's real. That's valid. And to me, that's the only thing that matters to me, is that what works for you and your kid. And that's the importance of it. All right. So we try to keep it at about an hour out of respect for our guests and our audience, because they're after listening to me for an hour, they're pretty much done. So did we miss anything, Dr. Medalen? That do you have something, Ginger? Were you waving at me?
I said they're probably done with you after 5 minutes.
No, no doubt, no doubt. They probably just mute me. Actually, we should add a feature to the podcast where whenever your big dog is speaking, just mute and then unmute whenever. I kid. Everything I say is awfully important. So, Dr. Medalen, do we miss anything that you want to talk about or go over that's important for pet parents out there?
I think we hit most of it, just look around your area, start asking questions and see where it takes you. There are so many options out there. If you just start diving into the dog world, it opens up. There's so much information and knowledge out there open to you if you just start searching.
Well, I'm going to, that's for sure. And perhaps we'll do a follow-up podcast after I take Indiana and Grayson to see a chiropractor here, wherever I can find one here in Tennessee or elsewhere. That I did make a note here that I've just forgotten I wanted to touch on. Affordability is chiropractic is care. Is it covered by insurance at all? Or because you mentioned, like you said, yeah, if you're doing any type of musculoskeletal surgery, that's 10 grand plus then. So I'm assuming chiropractic care is a lot more affordable than that, but does insurance cover it?
There are some insurances that cover it and some that do not. So even if your insurance company says that they cover chiropractic care, there might be some caveats in there, right? Depends on the individual insurance. I've worked with ones that have covered it 100%, no problems, and I have ones that have not. So it's really up to you. And then, of course, like most insurances, they won't cover any sort of wellness or preventative care.
Yeah, that's Western medicine for you right there.
Yep.
Well, I didn't mean to leave the episode on a down note, and it shouldn't be because it's exciting. It's inspired me to go and just I just believe that the more hands you can get on your kids from specialists of all sorts can give you more insight into the condition of your kids. All right, Dr. Medalen, where can we find Cloudberry Lane and where can we find you on social media?
You can find us, Cloudberry Lane Chiropractic, on Instagram and on Facebook. We are based in Portland, Oregon, and we are slowly expanding. So yeah, if you ever have any questions, concerns, if you just want to pick my brain, I'm always happy to answer questions for anyone, no matter where they live.
I didn't know Portland was still standing.
We haven't burned to the ground yet.
I walked the entire length of the West Coast from Canada to Mexico to raise awareness. With Indiana, actually, interesting enough. So even though he is 12 now, he has actually walked 1,700 miles with me on the West Coast. And I love it. And I love Portland, spent some time there, and I love it. But it seems like things are getting a little crazy over there. So, and it pains me because it's such a animal friendly part of this country, very progressive. You guys, that's probably why you have chiropractors there more so than in the southern states. So all right, give us your social media one more time. I didn't write that down and I need to make that note.
Cloudberry Lane Chiropractic on Instagram and Cloudberry Lane Animal Chiropractic on Facebook.
So you're not on Twitter. All right.
Not on Twitter. I can barely keep up with the social media we have.
I think everybody is maxed out on social media. I asked for Twitter because I'm trying to get Dogs of Twitter. Dogs of Twitter, Facebook and Insta do a wonderful job with getting not only the cute pics and videos, but also getting data out to pet parents. Twitter, not so much. Dogs of Twitter needs a lot of work. So it's kind of a personal mission of mine to try to get more information about health and wellness and important issues in the dog communities. I love the Chihuahua and the Frenchie videos; those are great. The Dachshund videos, but we need more content like this that's worthwhile and meaningful for pet parents. So, all right, Ginger, we've reached that time of the show. Do you have a Puppy Up Foundation cancer tip of the week for us?
I do. It's not necessarily just cancer, but one of the things that I have forgotten to even mention to people all this time is that those yearly vet visits and maybe even every 6-month vet visits are very important. At least on one of those visits, you should obviously have complete blood work. I would do ultrasound and x-rays of anything that you think might be a problem. A lot of times your pets, they're, as we've been saying, they don't show pain, but you can tell a little bit of a behavior issue, and having the x-rays and the ultrasound can lead to an early detection. And it has, and as we've talked about before, in my case with Lily. But yeah, I think everybody needs to be checked out by their vet. Their dogs do. Dogs are human to me too. So everybody, all the dogs and the cats, be checked out by the vet at least once or twice per year.
Yeah, and also there's an age consideration. As your Fuzzybutt ages,
Right.
The frequency of visits that's more important. And also, I like that what you're saying is that you have an older dog. This whole thing, I guess, this whole episode is about pain, right? And pain, and your kids can't communicate that, so you need to have hands on them. And also, like you were saying, is that it makes sense to have advanced diagnostics done for your Fuzzybutt, especially the older they get. Maybe not when they're 4 or 5, when they're up there, when they're getting concussions, running around being crazy kids, but certainly when they get up there, it's important to do maybe an annual ultrasound just to see if there's something going on that your kid's not telling you, and then nobody else can see. And now I'm going to put it on the list that I know I'm going to anger some veterinary oncologists out there and some veterinarians out there, but that's the kind of guy I am. Put seeing an animal chiropractor on the top of your list, because I think you made a beautiful case, Dr. Medalen, about there are times that you can see pain pathways that other specialists and other practitioners can't see. Is that a fair assessment?
Absolutely. And I'll add on to that we see a lot of people who get x-rays on their dogs at 2 years old to just start a baseline, because if you don't have anything to compare it to when they're 13, you don't know what changes have occurred. So yes, absolutely, go in and see your vet at least once a year. Make sure that they're up to date on everything, that you're checking everything out. And when you go to the chiropractor, I see a animal more often than a vet is going to see that animal, right? So I have caught things like cancer. I've caught pancreatitis. I've caught seizure disorders. I've caught things that were not to the point where that it wasn't so serious yet that the animal was showing it. And so the more people, the more of a team you have behind you, and the more you utilize the resources around you, the more likely you are to catch some of these things early on.
Yeah, the more you use the resources that are around you, and chiropractic medicine is definitely an important resource. All right, Ginger, we've reached that time of the show where I ask you, I know I did, I already know it. Did I screw anything up? Did I leave anything out on this episode?
Well, the only thing that you may have screwed up is it's Grayson's left leg. It was amputated. So there you go. I just wanted to point that out, but if you had asked, I wouldn't have
Hey,
pointed it out.
I never pay attention to my kids. I truly am. I'm dyslexic, and I get things inverted in my brain all the time. But I can see your Fuzzybutt over there, Dr. Medalen. I can see Nero. He's going to burn down your house if you don't go pay Nero some attention. So thank you so much, Dr. Clara Medalen, for being here on this episode of Fuzzybutts and Friends. I'm going to take my kids to the chiropractor here, and I'll find one, and we'll have you back on maybe in a year or so. We'll follow up and talk some more about this. How's it sound?
Sounds great. Thank you so much for having me.
All right.
Thank you for being on the show.
Here. Yeah, thank you very much. All right, everybody, and thank you for joining us with this week's episode of Fuzzybutts and Friends. You can find us on your podcast platform, that's Spotify or iHeartRadio, and some of the other ones as well. Or you can actually watch the video on our YouTube channel, which is FuzzybuttStudios.com. That's it for this week. Until next one, puppy up. Talk soon. Bye-bye.